Good day, all, and welcome to the Men of F.E.A.S.T. Today, our topic is factors increasing interpersonal effectiveness for eating disorder caregivers. Accessing the road to recovery for our loved one requires that we become and continue to be effective caregivers. That means we need to learn how to best support our loved one and work with partners, spouses, family members, friends, and treatment providers. So, although we may at many times during this journey feel isolated and alone, it's important that we work toward more interpersonal effectiveness. How do we do that? There's numerous methods. You may likely have your own strategies and procedures that work for you. I'll mention a few since this discussion is simply meant to remind us to pay attention to our efforts toward achieving greater caregiver interpersonal effectiveness. So, some ways to increase our effectiveness: decisiveness, knowing or having the practiced ability to determine what is needed. It looks like this: moving forward when evidence suggests action is necessary. So, in eating disorder caregiving, that might look like moving quickly through the denial and resistance phases of change and seeking resources or taking action when you feel something must be done to help your loved one. It's all about moving forward and understanding that course correction along the path doesn't mean you've made mistakes. It means you're learning to implement tools and learning as you implement those tools. This is the opposite of analysis paralysis, which is not taking action to restore or stabilize your loved one's weight until you've completed volumes of research, even though you see your loved one is not consuming what they need. Closing the skills gap. Skill is the result of repeatedly applying knowledge or ability. When we talk about skills gaps, that doesn't indicate that we don't have particular skills. Skills gaps indicate we've not overlearned or over-practiced a skill to the point of proven effectiveness. So we may have the theoretical knowledge of a tool, but we've not used it enough to become proficient with its use under duress. So we as caregivers close skill gaps by, yes, learning about particular tools, but then practicing the use of those tools during relative good times, so they are available on command during bad times. And that autopilot response is skill. For example, when you've practiced finding wise mind during minimally stressful times, then you're better able to find wise mind and implement distress tolerance during stressful eating disorder behavioral moments. Remaining clear of emotional roadblocks. We may have practiced tool use and have skills, but our skills can become eclipsed by our moods or interfered with by our emotions. And this reduces our interpersonal effectiveness. Awareness of what we feel and when we feel it, along with engaging in both a mental and physical pause before we react, so that we become responders rather than reactors, is what allows skills to supersede our moods. Knowing when to prioritize both short-term and long-term goals. Both short-term and long-term goals are vital, and likely at varying times along this journey. Always sacrificing one for the other is probably not prudent. Here's an example. When our tolerance for distress is low or unpracticed, we may give up during eating disorder pushback. We opt for peace in the moment, but perhaps push the inevitable conflict a little farther down the road, where it will be faced another day, perhaps in a strengthened form. Or maybe we've not shown confidence in a partner caregiver and not given them the opportunity to engage in their own learning curve regarding how best to support our shared loved one. This means in the short term, things get done the way you know they need to be done. However, in the long term, this adds to your own burnout and doesn't give your partner an opportunity to be as effective because they've not had sufficient learning opportunities. Understanding environmental factors. We're sometimes precluded from attaining the level of effectiveness necessary to make efficient progress. And some of the factors we'll run across are resistant to change. People, places, events, and things. There are limits within our environment, and radical acceptance and distress tolerance are important skills when navigating these environmental factors. So efficiency may suffer or be non-existent for some time, but progress must still take place. Ideally, the road to recovery is not laden with obstacles, but in reality, there's lots of traffic and roadblocks. As caregivers, we practice our skills, cope ahead, address barriers, and proceed skillfully. Suspending limiting beliefs. The story we tell ourselves colors our reality and our outlook. For example, if you picture yourself or a partner caregiver as ineffective, you've set the stage for both struggle and suffering, not to mention caregiver misalignment. Some of that suffering can be minimized or removed by a learning on the job type mindset, where you recognize progress on a continuum, moving from less effective to more effective, both yourself and other caregivers. On the road to recovery, as in freeway driving, if you stare at the rear view mirror or diversions on the side of the road as you're attempting to move forward, you tend to drift backwards or sideways.